Hey everybody, Luke Gordon here, and today I want to talk about inversion tables. And one of the most common questions I get for a lot of our clients who have issues with lower back pain and potentially sciatica pain. So that sciatic nerve pain, which is the pain that tends to shoot down the back of your buttocks and into your leg. And so one of the common questions is, will using an inversion table to decompress my spine, will that help with my lower back pain and or my sciatic nerve pain? So I'm going to talk you through the answer today, and a lot of the answer depends basically upon the underlying cause of the pain. So it really depends on what's causing your back pain and your sciatica to help you decide if potentially using an inversion table will help you. So I'm going to walk you through kind of the common scenarios for who it's going to help and who potentially it's not going to help. In rare circumstances too, you may want to avoid the inversion table because it could make your pain worse. So I'm going to talk through all of those. First thing too, I'm not necessarily recommending that you use one. If you do want to use one, my best advice too is to work with someone who kind of knows how to show you how to do it, like a qualified physical therapist or someone like that. So let's talk through that. Before that too, if you would give me a quick thumbs up and a subscribe, I'd appreciate that. So let's get into the question. So basically, do inversion tables work? My overall answer to that is yes, they do work. They do help you decompress the spine, and for a lot of people, decompressing the spine is going to help with their back pain, especially if they have degenerative causes of back pain. So you've had an X-ray or MRI, and you've got some degenerative disc disease, you've got some degenerative joint disease, some arthritis, things like that. You know, they can see on your X-rays that the disc height has shrunk a little bit, so the space for those little nerve roots to exit the sides of your spine have gotten smaller, or just the fact that your joints are now arthritic and they're rubbing against each other more. It does help. So folks with degenerative changes in their spine tend to have a hard time standing for long periods. They get that really sore spot in the lower back. And so for them, that's who I tend to favor the inversion table for, just because simply we understand that the underlying cause of their back pain is too much compression, too much, again, joint deterioration, disc, deterioration, and so that building pressure in the lower back, it really can help. And if you have enough pressure in your back that it's causing you some nerve pain, like sciatica, like I was mentioning, this can definitely help you take the pressure off. The approach I tend to use with those folks is say it makes sense to try it. Now let's try it and see how it works. And so let me walk you through how that works a little bit. So with the inversion table, by the way, I'm going to make a different video that actually shows you how to use the inversion table. I'll pop that up right around here somewhere in the video. But so let's say that I recommend that they try it. I'm going to say, okay, here's the inversion table. And we're just going to go back slow at first, right? So you go back about neutral, and then maybe you only go back 30, 40 degrees at first. So that's a good way to try it at first, to see that if you take the pressure off of your spine, is it going to help with your pain? So that's one of my favorite things about the inversion table is it's trial and error. And we have our clients in the clinic try it here before they go purchase one for home. But certainly if I'm talking to someone who's out of town, I'll say, well, go to your closest vendor, like a sporting goods store or something like that, and then see if you can try it while you're there and see how it works. So they usually let you take it for a test spin. So that's my recommendation. Again, yes, it helps with back pain, especially if it's degenerative type back pain. Potentially it could help with a bulging disc type of pain as well. You just have to be careful. I mean, obviously, if you're using it, you want to make sure it's not making your pain worse. And if you've got a really irritated, hot disc that's putting pressure on your nerve, it could make you feel worse. Whereas if you waited a week or two and you were doing the correct exercises already for a bulging disc, then it might be a better way to use it. So again, there is some gray area there, but if you feel like your back pain is pretty consistent, it's not overly aggravated, it's a decent thing to try, especially if you have someone helping you out. So that's my total story is, yes, it works for a lot of types of back pain. No, it doesn't work for all of them. Yes, it could make you worse if you're not careful. And yes, I would highly recommend that if you want to try it, enlist the help of your local physical therapist. Ask a question below the video if I can help you with that. And just be cautious, just like anything else. And yeah, so give it a try. Let me know what you think. Leave messages or questions below the video if you have any. I'd love to help you out. And thank you for watching. I'm going to make another video that covers how to use the inversion table, where I'll give you more guidelines on how long should I use it, what should it feel like, stuff like that. So that's it for this video. Thanks for watching.